Welcome to the First Nations Health Managers Association's weekly town hall. Over the next hour, we will provide an update on the COVID-19 pandemic and then focus on what we can do to close the 87,500-hour life expectancy gap. Join us as we speak with health professionals, subject matter experts, and Indigenous leaders. Send us your questions to fnhma@ihtoday.ca. We want to hear from you. And now your host, Marion Crow.
Tansay from the territories of the Haudenosaunee, the Mississaugas of the Credit, the Wendat, the Huron people, and many other diverse nations. We are broadcasting from Toronto, and it is a pleasure to be partnered with Indigenous Health Today, who is owned by NationTalk, to bring you this information. You'll notice that we are transitioning the show a little bit. We are still going to bring you all of the COVID-19 epistats, but for the next little run, we are going to be talking and unpacking how we reduce the gap in our morbidity rates. 87,500 hours less life to live for Indigenous people across Turtle Island. So let's talk about how we get our life expectancy back. That'll be our transition time. So as you know, I am Marion Crow. I am from the Pie Pot First Nation in Treaty 4 territory, and very excited to now be living, working, and playing in the unceded and unsurrendered Algonquin territory. Marion Crow, CEO of the First Nations Health Managers Association. With us today, we have two lovely ladies. We have Robin Buckland from Indigenous Services Canada and Corey Duckchi from Siksika Health Services. We are going to talk long-term care, elder homes, so get settled in. Grab that popcorn, refill your coffee and water, and if you have a question or comment, send them to FNHMA@ihtoday.ca. Well, that felt like a long intro, so let's get rid of the crow and bring in Robin Buckland. Welcome back, Robin, to the FNHMA Town Halls. Come on into the crow's nest, Robin.
Great. Thanks, Marion, and thank you so much for the invitation to join you and your viewers again for a second time since this wonderful pandemic started. I would like to start by acknowledging that I'm taking this call today from the unceded and traditional territory of the Algonquin people. So I'm really happy to be here and very much appreciate the invitation. I'm the Chief Nursing Officer for the Indigenous Services Canada, and I'm also a Director General who has primary health care. A couple of files within that are the all-important home and community care program and the long-term care efforts as well. So I'll just jump right in and give you a brief update in terms of the EPI data that we have of late. So this is as of February the 18th, Miriam. We have a total of 3,656 active cases of COVID in First Nation communities. Very sadly, our total fatalities to date are 644. Reflecting on the number of active cases in communities where there's more than 10 active cases per community, I'll just go through the provinces. We have 5 communities in British Columbia that have greater than 10 cases, 14 communities in Alberta, 3 in Saskatchewan, 23 in Manitoba, 27 in Ontario, and 9 in Quebec. And Omicron continues to be the predominant variant across the country. In terms of an update on vaccines, First Nation communities continue to do a very good job in terms of vaccination. They're playing a critically important leadership role in this regard. We have 678 communities having access to vaccine clinics, so that's really super great. The total number of vaccines that have been given out is actually quite impressive as well. We have 1,084,988 vaccine doses have been administered so far, so that is quite impressive. 425,514 of these doses were actually second dose, so that's really good as well. With another 128,042 of these were third doses, so that's even better news. 87% of individuals aged 12 and plus have received their second dose, and 24% have received their third dose. So increasing the protection as we go up with the number of doses. So really good to see that increasing trend. And over 48% of children aged 5 to 11 have received at least one dose of the vaccine. So that's super exciting. And just before I transition into home care and long-term care, just want to underline that the vaccine is obviously our best protection and the best tool that we have in our toolbox against COVID-19. But we have to remember all of our other tools in that toolkit as well. Just the importance of continuing to mask as appropriate and as according to the epidemiology in your area. It's always a good idea to make sure you're masking when you're out and about, and maintaining those physical distance. So just more tools in our toolkit to continue to protect ourselves. So I'll transition, Marion, to home and community care. So home and community care, I think many of your viewers will actually be very familiar with the home and community care program. The home and community care program is actually delivered in 686 First Nation and Inuit communities across the country. So this equates to 100% of Inuit communities and 98% of First Nation communities. So this is super good news. Funding for this program is at more than $110 million a year. But as we know, the needs are great. And in line with this, in Budget 2017, there was an additional investment that I was pretty excited about when it came through. It was an additional investment of $184.6 million over 5 years, which was used to improve home care and access to palliative care in communities, in Indigenous communities. The home and community care program offers a variety of services, as you probably know, everything from nursing assessments to case management. And there is flexibility as well within the program to offer additional services, additional rehabilitative services such as physio and occupational therapy. So that's important to keep in mind. But again, as I said earlier, the needs are great, and I think we need to continue to do better in terms of meeting the needs of certainly seniors living in communities. And we're working currently on an engagement towards a continuum of continuing and long-term care. It doesn't roll off the tongue very well, so I'll say it a couple of times. But this was actually supported in Budget 2019, where we saw an investment of $8.5 million to invest in engagement on that continuum. So the engagement was to be led by Indigenous communities and Indigenous partners. The objective was to co-develop policy options for what a holistic continuum of continuing care, continuing and long-term care would actually look like. Well, that was 2019, and in 2020, the pandemic hit. So rightfully, all efforts at that point turned to fighting the pandemic. And again, I think many of your viewers and all of your viewers can relate to that. It really was all encompassing our efforts in terms of the pandemic. But as we saw during the earlier waves of the pandemic, long-term care homes and seniors were hit particularly hard in the first few waves of the pandemic. So how do we get back to this continuum? Recognizing that seniors were being hard hit and long-term care facilities were being hard hit by the pandemic right across the country, the government announced an investment of $186.8 million over 2 years to specifically address the gaps in supportive care facilities and to provide additional home care in Indigenous communities. So this was a really positive step in the right direction as we went through the pandemic. Now, as we're starting to see the light at the end of the tunnel in terms of the pandemic, hopefully, we need to get back to thinking about the engagement and thinking about working with Indigenous partners and Indigenous communities to be able to develop options for a holistic continuum of continuing and long-term care. Our hope at Indigenous Services is that we're going to be able to have a national event to reinvigorate efforts, and hopefully we will be in a position to come forward with a report on what the recommendations are for policy options moving forward. So it's really exciting, but I think as I said, the time is here. I see the light at the end of the tunnel, and I'm really looking forward to reinvigorating that discussion in terms of long-term care and what we can do to support seniors in their homes, and seniors to stay in their homes as much as they can, as long as they can, within their communities and surrounded by their loved ones. So thank you, Marion.
Thank you again, Robin. Don't go away. Stick around with us because we will have questions and answers for anyone listening and watching right now. You can send those questions to FNHMA at ihtoday.ca. And that now takes us to our first break. We'll be right back.
There's no such thing as an old addict. You either get clean or you die. I knew I needed to stop for my kids and my grandkids. There is hope, and there is people that do care and they do love you. I learned that our culture teaches something very powerful: compassion. Through acts of kindness and compassion, we find meaning in ourselves. I found connection. When we're connected, we're never alone.
There's lots of bullying at the school that I come from. I ended up in a neck brace. I had a concussion. I got kneed in the back of the head. Sometimes things can get really bad and you think, there's no point of being here. The support from people around you has a lot to do with the anxiety and depression. Because I'm different, a lot of people didn't understand. Through acceptance, we find belonging.
I used to feel such shame. It was hard being surrounded by women who trauma and abuse left cruel streaks, violent behaviors, and disconnected ways of loving. And now I'm freeing myself from that shame. This is where our societies, our circles, our connection to the land comes in. Learn to be kind to yourself and to others.
I love seeing the Soar Above Stigma campaign messages. Thank you so much to Dr. Brenda Rastool at First People's Wellness Circle and to Dr. Carol Hopkins at Thunderbird Partnership Foundation for partnering in joining those messages and sharing them with you, our listeners, and our viewers. And on that note, a huge thank you to all of the Indigenous media partners. This is airing live right now, but if you check out Saturday's 5 p.m. Eastern. You can see this on APTN. Thank you, APTN, for supporting getting this messaging out. It's so appreciated. Let's jump to our next guest now, folks. We have with us from Alberta, from Siksika Health Services, we have with us Corey Duckchief, who is the boss at the long-term elder care facility in Siksika. Corey, come on into the crow's nest and welcome to the FNHMA Town Hall.
Okay, good afternoon, and thank you, Marion, for that introduction. I'm very happy to be joining this program, and thank you for your sharing, Robin, as well. My name is Anetsikana Suyaki, and that's called Bright Shining Woman, which was provided to me by a very valued traditional elder who was also a medicine man. And that story behind my name was basically I was like 3 or 4 years old, and every time elders would come and visit my grandmother, who I was basically her tail, I would actually lead them to their chair and provide them a cup of tea. So I was given actual woman's name ahead of my time, even though I was still quite young. So that truly does hit the note of how I was brought here to my role as team leader at the Siksika Elders Lodge. Our Siksika Elders Lodge is a 30-plus year facility where we provide care for our elders and as well as for the disabled from our community. We've also opened our doors to many non-nation members as well, where we provide 24/7 assisted living at that time when they first started, but has since changed to us going to the level of long-term care simply because health needs have changed. Social determinants have added in to other First Nations as well as ours. You know, the trauma of residential schools alone, the trauma of addictions, you know, it's added on into our community where we're seeing health needs growing. You know, we have more of a need for more accessible homes out in community. We have more of a need for elders care out in community. When I was 3 years old, you know, residing with my grandmother, at that time, we never knew any types of issues such as dementia or Alzheimer's. You know, my grandmother was like 73 years old. She was still hauling water for us. You know, it's a total change from then to now. And, you know, it's often voiced, especially on political stages, how our seniors or our elders are most precious. Yet, you know, we don't see that. It changes over time. And it's very frustrating, especially for myself, because I have such a close tie that, you know, it's very sad when an elder has to leave their own First Nation to reside in another facility off reserve, often, you know, some at 2 to 3 hours of a drive for their family to travel to visit them. And then it's extra frustrating because these COVID restrictions are actually, you know, putting more of delays in for their families to visit them in these care homes. And quite often these care homes, you know, it's like they're very time limited, we find, from some of the stories that we have with some of our residents coming back. Time limited where, you know, there's only a certain amount of time that the staff are able to spend with those residents there. So basically they're isolated. They lose that connection that our First Nations people so very much value. You know, we need to take care of our elders now and our other vulnerable populations, where we're going to ensure that they have facilities, that they have places that they can actually age in place. You know, they've all once contributed to our community. We've seen the successes grown, especially within Siksika Nation and other First Nations from year to year. And the past decades, we've seen so many, you know, leaps and bounds as to what successes we've had here. You know, we do definitely need to take care of those who have contributed greatly to our communities. I believe in May, Alberta did a review a continuing care review where it was flagged about issues of our First Nations elders having to leave communities. And I believe they mentioned that there were only about 147, supportive spaces for elders on reserve today. And with the number of elders, that need is going to be more, because by 2030, that number of elders within communities are going to grow. So we're looking at probably more than 1,200 spaces that will be needed, not just for the elderly, but for the disabled as well. So again, there's a huge amount of information there. There's a huge amount of data we've collected. We need to see action put into that data. And gratefully, we've had such a great team here at Siksika Health Services. As you mentioned, you've met Tyler White. He's our CEO as well, and a great leader here who's very supportive. And we have leaders within our community as well, like Sam Crowfoot, who's also contributed greatly. He's also our chairperson for Siksika Health Services. And for our Siksika Health Services team as well, we have such a great team here, so much so that when the pandemic hit, they knew that the Elders Lodge was one of the priority areas that needed to be protected. So in collaboration, we actually worked together with our teams, our health teams, to actually put measures in place 2 weeks ahead prior to the province implementing their own. So that really protected our residents here at the lodge. However, sadly, we did lose our first resident at the beginning of this month to COVID. And our hearts go out to all of the other care homes across Canada, because, basically most of the deaths that did occur in Canada were seniors, sadly. And it shouldn't take a pandemic to bring out the issues that we have to address. And we need to move forward. We need to, put actions to the reconciliation. The calls to action need to be implemented, whether it's through sustainable funding or coming together in collaboration to discuss other ways of healing and moving forward together. But again, the frustration is here. The frustration of the issue of our family members having to leave the reserve and not being able to age in place, which is a basic human right. They should have that choice. But unfortunately, they're health-wise, they still need that support. And that's something that's not going to happen at home. There's caregiver burnout. There's not a great understanding of dementia or Alzheimer's. So, we're working closely with our elder services and other services to actually start educating on this, educating the caregivers on what's needed. There's a lot of great people out there who love the elders and who continue to want to support them and the disabled in the community. But I know it's high time that we start moving forward and getting a up-to-date facility, one that's going to house and safely house our people within our community, allowing them that time to age in place here. We do see a lot of cultural differences from facilities off reserve as opposed to what we have here on reserve. I know everybody is trying their best, especially during pandemic, but for here, our staff have become like family to some of these residents. And rightly so, because culturally, our traditions, we were taught that. We were taught to care for each other. We were taught to help each other. So again, I do thank you for your time. And, there's basically so much more I could share. And I will leave that for the question and answer. And I do thank you. Gede Matsin.
I loved hearing what you were saying in that, Corey, and don't worry, we are going to have questions for you. I can see the inbox already lighting up. I do want to say a special hello to a couple of our viewers. I do know that on APTN Facebook, we have Loretta, Jarrett, Ricky, Hey, Patsy is watching too. Leona, Clifford, Madeline, we see you too. And a huge shout out goes to FNHMA President David McLaren, who is tuned in as well. Hey, boss, good to see you. And I hope you keep watching. So, I talked about questions. If anyone does have questions, you can send them now to fnhma@ihtoday.ca. And you might as well do that now, because it is time for a quick break. We'll be right back.
I used to feel such shame. It was hard being surrounded by women who trauma and abuse left cruel streaks, violent behaviors, and disconnected ways of loving. And now I'm freeing myself from that shame. This is where our societies, our circles, our connection to the land comes in. Learn to be kind to yourself and to others.
There's a harsh world out there telling us who to be, what to be, telling us that we don't deserve love and respect unless we're something we're not. After I got assaulted, after I went through the trauma, I went back home and I connected with my roots and I connected with my family. Their wisdom helped me a lot. My family, my kinship, they rejuvenate my soul. They remind me that I deserve love. Our culture teaches us something powerful: compassion.
Well, thank you for those messages once again. All right, Robin Buckland, come on back into the crow's nest. I'll get you to unmute yourself. We do have a question, and I'm going to deal with the COVID aspect first, if you don't mind, Robin. And feel free to pass on the question to both of our guests. We can always bring them back to a health professional and have them answered and send it back to you via email. But Robin, here's a question for you. What can you tell us from your nursing capacity in terms of long haul COVID? What are some of the dialogues that are happening that talk about supporting people with long haul COVID, for those that have never heard that word before? Can you tell us something about that, Robin?
Thanks for the question, Marian. I would say that there's still so very much to learn about long haul COVID and the effects of COVID over the long term. So I think we're still really learning in reference to that. Certainly, it is going to increase the burden of illness in communities, and the need for programs such as home care and being able to support people who are suffering from long haul COVID. But certainly, again, I think we're at this point, we're just at the very beginning of trying to understand it. So I think more to come, Marian.
Thank you, Robin. We really appreciate that. As the science evolves, so does our reaction. Robin, I'll get you to mute now. And Corey, come on back into the crow's nest, my cousin from the province next door. Corey, share with our listeners and our viewers how you were able to get that supportive center for our most valuable population, our elders, our cookums, our mushums. What did that journey look like for Siksika?
Well, the journey here started about 30 plus years ago. And from what was mentioned to me, it was actually my grandmother, Emily Duckchief, who actually took that lead in working with leadership at that time for chief and council, and as well as for health services at that time. So again, it was the letter writing, but basically, collaboration with the elders at that time. They used to visit each other. They'd walk to go and visit each other at 6 a.m. So these issues were being brought up at their tables. What's going to happen to us, or what's going to happen to the future generations of elders who won't have any caregivers at home? So they started letter writing. They started working with leadership and basically came together with the province of Alberta, and they actually made application for grants. And so that came about bringing the Siksika Elders Lodge into place. So this facility it's outdated, but we've been managing with funding in collaboration from either ISC or Indigenous Services Canada, in other words, or other funding opportunities that we've applied for to retrofit the building, to bring it up to standards that we need to. So it's been the long haul here. I've been here for about 6 years. Originally, my background is in the legal area, so this is a complete eye-opener. But again, recognizing that it should be the basic human right to actually have a facility like this in every First Nation. I mean, we've had other First Nations come to us asking us for help, where they actually have elders in their community that are wandering because they're affected by either dementia or Alzheimer's. That shouldn't be happening. We need to take care of our elders, and by working together with other First Nations, there's a lot of great models out there culturally that will fit each First Nation. And by putting our actions into motion, definitely there are good things that can happen, such as the Siksika Elders Lodge that we have here today, where we truly are blessed to have this facility. There were, of course, a lot of improvements and a lot of other barriers we've seen, but we've managed with such a great team, such a great leadership team. We've overcome them as much as we possibly could, and well within our limits and well within scopes. But again, we can't forget about the human factor, and that human factor is what matters and what actually lengthens the lifespan of an individual. I mean, I can attest to that because I actually, we had a resident here who was deemed palliative off reserve at other facilities. However, once he was brought back, he stayed with us for almost another 6 or 7 years. So, basically it's not up to certain other things that are there. It's how much is given to a person, how much they are valued, and still very much our First Nations culture is very much a big, big difference in assisting our residents that we have here, especially care-wise. Thank you.
Oh, don't go away, Corey. I have a couple more comments and questions for you. I think when I was doing my prep that I read that your facility is also accredited. Oh, I get the nod. Unmute yourself, Corey. Tell me about that process. And while you think of the response, for our listeners and our viewers who are watching the live streams on various Facebook's accounts and also listening to us on Indigenous Radio, an accreditation service is not a mandatory service in First Nation communities. It is mandated to be accredited when you are a hospital and provincial systems, but it's something we're very much encouraging. Quality assurance and accreditation is actually one of the competency domains of the certification program at FNHMA. So what does that bring to you in terms of your partners to sit at the table with other accredited organizations? Corey, what does that tell your membership? Talk to us about that as well.
Well, we've actually, Siksika Health Services, which the Siksika Elders Lodge is under the umbrella of that whole entire organization. We've been accredited for about 14 years, I would say, close to that. And, basically we're a nationally accredited organization through Accreditation Canada. We've met a number of required organizational practices, a number of standards, various standards. But for the Elders Lodge, at that time, there are no specific standards or specific standards that are for assisted living homes. So we've been actually either exceeding or meeting all of the standards for the long-term care area within Accreditation Canada. So again, it does truly mean a lot, especially for our members, because to our members, accreditation means that we are bringing the best quality services that we can possibly provide to our First Nations or Siksika Nation people. And, quality health and wellness is very, very integral to us, especially as our, generations are, there's more of a bigger baby boom now than we see prior. And, it's very integral that we continue to bring any of the more innovative services that we see out there to Siksika Nation. I mean, there's so many things happening, especially because of pandemic. You see Doc in the Box, or you see the Zoom, basically equipment where we're able to connect, for example, our residents with their physicians that are elsewhere. So there's a lot of great aspects to being accredited, but again, it's basically opened up a lot of doors for our organization here, and rightly so, because there's a lot of great practices that are taken from across Canada, and for us to be able to include that and to basically share our own best practices, definitely is positive for us.
Thank you so much, Corey. And now, Robin, I'm going to ask that you unmute yourself and come on back into the crow's nest. Robin, we know a lot of nations are interested in keeping their elders aging at home safely in our nations. And we know all of the things that this supports in terms of retaining culture, retaining all of those beautiful languages as well. Robin, what does the future look like from where you sit in terms of investing in long-term care facilities, aging at home safely where we need to be? And you did reference some very significant investments when we were chatting earlier. But how do you see tomorrow looking for elders at home in our nations?
Yeah, thanks for the question, Marion. And before I answer the question, I think I just would like to acknowledge and thank Corey for all that she's shared so far. It's just so incredibly interesting, and such. I know in Siksika they're doing a lot of really leading practices. I'm just thinking back, Corey, to earlier on when we got the vaccines. I think your community was one of the communities where they actually opened up the clinics for immunization to surrounding communities. So it sounds like you guys are doing a lot of really great stuff in terms of leadership and leading the way, and in terms of assisted living and caring for elders. And I also appreciate the personal stories that you've shared, Corey, so thank you for that. So in terms of keeping seniors in community and surrounded by family and friends, and I think I see a bright future, Marion. I think that we, again, through the pandemic, we've realized what an incredibly important area of the health system this is. And I think that the work that we're doing in terms of that continuum of long-term and continuing care services is going to be critically important to coming forward with what that should actually be looking like. It needs to be defined, and I think it needs to be articulated by Indigenous partners and Indigenous communities. And I think that it's not necessarily going to be all about long-term care facilities, but rather having that continuum where we can look at additional supports in home for seniors, and then and as I think Corey said as well, for people with disabilities as well. That's going to be a really important part of it as well, because there's many young people that struggle to be able to stay in their own homes as well. So my hope is that, and my hope is that the future is quite bright, and that we'll take advantage of this opportunity post-pandemic to really put forward some innovative and Indigenous identified approaches and visions in terms of what the system could look like. So hopefully that's answering your question, Marion.
It is. Thank you so much, Robin. Corey, I'm coming back to you. Corey, what would you recommend to other nations who are looking at doing a very similar structure that Siksika has been able to achieve? Is there things that we should be looking at now to plan for a supportive care for elders, for seniors, for non-nation members who are coming to the health center for services as well? What would you tell, let's say, James Bone in Kesey in Manitoba, who's very keen to get a supportive care facility in his nation? What are some words of wisdom that you can share with Mr. James Bone, who is trying to achieve what you've been able to do? So a very real life question, Corey.
Thank you, Marion. Definitely, you need to listen to your people, your membership, and especially your elders and the disabled as well. Listen to what they have. Like there are so many innovative ideas out there. Like, for example, ageism. It's not part of our culture. We were always taught to help each other out, listen to each other, be respectful of each other. We need to learn from our past and to be able to move more into a future, a more brighter future. We're seeing so many issues still continue with racism, or, there's so much more that we need to bring forward, especially learning from this pandemic. We've learned so many lessons from this, but again, as I mentioned, it shouldn't have taken a pandemic to bring up issues that are affecting our elderly or our seniors across Canada. They actually, what we've done is we've developed an actual business case. So going to the people, meeting with them, whether you want to call them stakeholders, we're calling them the people because that's what they are. And it's actually them that, the more that they understand, the more of a need that we have for facilities as such, the more that they're going to support it. There's so much more that we can do with an elders facility, including even a community center for them to continue, working on their health needs, whether it's physical or mental. There's so much more that can be done. But again, ultimately, it's going to go down to listening to your people, taking their input, and basically building that case, knowing that it's going to definitely justify the need for a facility for seniors or disabled. So again, that's the integral part right there. Also ensuring that they understand completely the reasons behind certain levels of care, for here. And that's the other part too, is the frustrating aspect, is that we can only go to a certain level of care. And then sadly, we're kind of capped simply because safety needs, health-wise, we need to ensure that our own staff are able to safely care for the residents that we have here. So, there's a lot of things we need to keep in mind, but again, it's, basically planning with your community, planning with your leadership. There's a lot of great ideas out there, and, there's a lot to learn from, especially from this pandemic. I mean, we didn't wait. As I mentioned, we didn't wait to implement our restrictions, especially in regards to COVID. But we also need to come together and, basically hold accountable the provincial and federal governments. They need to come forward and act upon our treaty rights, act upon truth and reconciliation. We really, really need to see more action put to those words that they're speaking. Because again, it's so many times we've seen it used on the political stage. We need more action to that, whether it's through sustainable funding, which would be excellent, but also through, the development of continued services for our elders and disabled in communities. Hopefully that answers your question. Thank you.
Thank you again, Corey, and don't go too far. I'll come back to you in a couple of moments. Let's invite Robin back in. Robin, in terms of investments that Indigenous Services Canada have been making, do you know what or how many supportive spaces that is being considered? Is there new builds happening that you're aware of? What does that national kind of picture look like for supportive care in our nations, if you have that information?
Yeah, and I think Corey's statistics were better than what I have, but the number that I have, Miriam, is we've got 61 homes across the country in First Nation communities. So that's interesting, but it's probably an underestimation of actually the number that are out there. We've certainly what we've heard so far in terms of the engagement that's been done to date is there is a need for supports from beginning to end. If it's about money for capital for builds, money for operating to continue to be able to support the ongoing expenses associated with running a long-term care facility or an elders lodge, for example. So all of that has been said so far. And again, the objective is to eventually go in and say, okay, this is what First Nations and Inuit partners have told us that is required. This is our recommendation in terms of where to go from here. So really the investments that we're currently seeing, I know that there are investments across the country where people are looking at trying to partner with provincial and territorial governments, and then also partner with the federal government to bring together funds from various different streams to be able to support the ongoing development of long-term care facilities and seniors residents on reserve. I think that I think we have an opportunity to build on all of that. I think that there are different communities at different stages. Like Corey has told us, it's really exciting to hear what's happening there as we move forward. And your question actually spoke to this, is just being able to share the best practices that have been learned through Sisika's experience and build on that. I know that you asked me specifically in reference to funding that's available, and I wanted to just take the opportunity, Marion, if I may, just to speak about the investment that I mentioned earlier on in terms of the 2-year investment of $186.8 million over 2 years that was earmarked to support seniors centers and seniors facilities and home care in communities through the pandemic. So we have done pretty well in terms of trying to get that money into the hands of community members. There are additional funds that are still available through that supportive care funding. So I just wanted to underline that. And that is basically looking at supports for nursing oversight if required in the facility, also looking at opportunities to improve infection prevention and control, which is ultimately really important during a pandemic, and environmental public health supports as well. So I just wanted to underline that those funds are still available to communities for those purposes. And my hope is that we will be in a different place after we've completed our engagement and be able to look forward to recommending an approach going forward for long-term and continuing care support needs.
Robin, don't go anywhere yet, and then I'll bring Corey in for some final comments. I tell you, this hour goes by so fast. Robin, let's unpack a tiny bit of the linkages to social determinants of health. So we know that when we are physically healthy and mentally and emotionally, when we're in balance, that means that other areas of our nations prosper as well. So I'm talking about those linkages to housing, to economic development. What does this mean in terms of supporting indirectly the other social determinants of health from your perspective, Robin? And Corey, feel free to jump in on this one too, because I'm very curious as to some of the language retention, and have you seen increased economic development in Siksika because of this instance? What are your thoughts, ladies? Robin, do you want to kick off and then we'll bring Corey in?
Yeah, for sure. As an old public health nurse way back in the day, the social determinants of health for me are everything. And Dr. Wong, as many people will know, our Chief Medical Officer of Health at Indigenous Services Canada, this morning at a briefing, he was talking about a particular issue, and he was talking about the social determinants of health. And he said, housing, housing, housing. And it's just so incredibly, such an important determinant of health. And I think that all the determinants of health are critically important as we go forward and need to be taken into consideration as we think about and plan and listen, as Corey encouraged us to do, listen and think about what is required to be able to meet the needs of community members. And because of, a history of colonization and a long history of the colonization and the effects of colonization and the trauma that have been experienced by many, Indigenous people carry an increased burden of illness in Canada. And it's because of the factors that I just said, but also that all ties into all of those social determinants of health. Just life expectancy for men, Indigenous men, is 72.5 years, and for women it's 77.7 years. And for men, that's almost 9 years less than non-Indigenous men. And in terms of women, it's close to 10 years less. So that is really very significant. And if we also look at some of the statistics related to chronic disease and the increased, burden of illness that Indigenous communities carry, chronic disease is as Corey was talking about, it's something really that needs to be taken into consideration when you're looking at a community's needs and what's going to be required to be able to respond to those needs in the future. So thank you for the question, Marian. It's absolutely essential to look at the social determinants of health.
Thank you so much, Robin. Corey, did you want to add on to that? And if you're comfortable, come on back in, and then I have another question right back to back for you, Corey. So I'll let you have the show.
Sure. Thank you. So again, it's so critical to address the life expectancy gap, especially for our future generations. We need to ensure that we have everything in place, especially in regards to supporting any economic development that we may need. Capacity-wise, time and time again, First Nations have proven that they do have the capabilities to carry out any types of services that we have for our reserve or our First Nation, especially in regards to addressing the needs of any health disparities, any health inequalities. Time and time again, we've proven this. Siksika Nation, we've really taken the lead on a lot of other initiatives. And with COVID, we've basically proven that we have the capacity. We've basically managed to keep our numbers down. Sadly, we did lose some members, but again, it's the communication to the community where we had that buy-in. So basically, we had such a great team going out there. We have our community response unit that's led by our Siksika EMS and fire department, where they actually went out to homes to test the families at their homes rather than having them go out to community. Basically, we're mitigating those risks of actually having this spread further. We actually had our own drive-through test site that's still going from 10 till 1 every day. We have such a great team, our communications team who helped me set up today, actually, big thanks to them. So we have such a great communications team that, they're basically being asked by other First Nations, can you come and give us a hand here? Because communication is truly key, especially for something to work. For the elders, basically, we've gotten them to join in on Zoom sessions where, it was so great at the beginning. They really loved this new platform of being able to communicate with each other. It was so interesting to them, but just to see them visit with each other, that's what truly, brought a warmth to your heart to see that happening. So there are a lot of great, important things happening out there. But again, what was taught to me is that if somebody doesn't understand something, they won't support it. So the more that you have people understanding whatever initiative you have coming forward, the more support you will get, especially from your own community. But again, I'll end off with that. Thank you.
Oh, don't end, Corey, in a minute or less. Is there something you would recommend? One of our viewers wants to know, what can we do remotely to bring a smile to an elder's face? Anything that our listeners and viewers can do? Do you want some letters sent? What would you recommend?
Yeah, absolutely. We've had letters, we've had cards, and, basically even opportunities to Zoom with some of the school-age children who actually want to read them stories. So we actually have a few things that are coming forward for our residents here. And then elders and community, they've been very patient, very understanding. And, the rest of our community saw that. So basically they're going to support that. And again, anything they can share, and any other First Nations, take care of your elders. Remember that they have a lot of knowledge behind them, and they mean very well, and they've earned that special privilege of being where they're at.
That is the final word. Corey, thank you so much. Robin, thank you so much. And don't forget, keep staying tuned right here on the FNHMA Town Halls as we seek to close the gap in our life expectancies. For future shows, come back. We're going to talk about racism, mental health, some addictions, diabetes, sleep disorders, food security, and that's just to name a few. So until next time, protect yourselves, be kind to one another, stay safe, and we'll see you next week. That's a wrap from this crow's nest. Hi.